If you're someone with arthritis, joint pain, and autoimmune condition, all three things that I have, and you're finding it really challenging to work out without causing more pain, you can't really seem to find the best approach for you, this video is specifically for you because I really want to break down different ways to get started if you just can't find the right approach and you're really frustrated. Maybe you're motivated to get moving, maybe a doctor told you try low impact exercise, but you just can't seem to get out of that pain cycle from exercise and you can't find the best approach for you. This video is specifically for you. I want to get into why does arthritis make it so challenging to work out and different tips to kind of get started, some different things I think about. So firstly, my name is Alexander Levine for anyone new to the channel. I am a personal trainer with inflammatory arthritis and ankylosing spondylitis since my 20s. So the past decade, I've been trying to find as many solutions for those dealing with chronic pain, joint pain, tightness in the body, to get moving safely, to start seeing the benefits of exercise, and to get out of, if you're really struggling, just you can't really seem to find the best movements, the best exercise for you, you just don't know where to go. That's where I was at. In my 20s, when I was diagnosed with ankylosing spondylitis, inflammatory arthritis, I was trying things I used to do, but they were just causing pain, and I had no clue where to go from there. So my goal has been to try to break this down, different for everyone. So I want to find as many tips as I can to help as many people as I can. So firstly, why is arthritis so challenging for some to go work out and start kind of thinking about progressing strength and flexibility? Why it's so challenging is we're dealing with joint pain, we're dealing with fatigue, we're dealing with a lot of compensations in the body. So generally, as we all age, we're going to have some tightness in the body. You might meet someone in their 30s and they're saying they have tight hips or their hamstrings are tight. But what can happen with arthritis is maybe you have tightness all over. And that tightness all over can make it very fatiguing, very frustrating, because you have to deal with a couple things at once. Maybe someone's tight in one area, and that can be a little easier to deal with. But if you have tightness all over, it can be very challenging to get going. So firstly, my first course of action, if you haven't been to physical therapy, I like physical therapy because we can really concentrate on the individualized approach for whatever's going on with you. So I'll use myself for an example. Having inflammatory arthritis, I had a lot of low back issues. I had sacroiliitis, which is SI joint inflammation, so my low back always hurt. But what happened is this caused a lot of weakness all around the low back. So the glutes, the core, everything became weak around it, and I started to move off balance. So I started to try to exercise without dealing with this first, and I was just leading to more dysfunction. And that's what can happen if we don't specifically break this down for each person. So for me, it was the low back, and I had to really go to physical therapy and get back in alignment, get the core going. My low back was really arched because I was favoring it. My posture got forward a little bit. So I had to really focus on that one area that was causing the dysfunction to get going. So for each person, I would go to physical therapy to try to address that first. See what's going on in the body. Maybe you just have a lot of tightness in the hamstrings or the hip flexors. Maybe you have some mid-back tightness. Deal with that specifically first, because that might be a huge relief to you to then go move. Maybe you're moving a little better, because what I see is if you're not dealing with the dysfunction and you say try to walk or run and you just start hammering into that dysfunction more and more if you're not specifically focused on it. So I would start there. Go to physical therapy, see what specifically is going on, and find a little direction that way. Oh, okay, maybe I need to strengthen the core more. Maybe I have to focus more on the upper back and stretching the front of the body. So maybe we can break it down this way first. Maybe you're someone that's dealing with foot, ankle problems, elbow problems. Break it down first, try to solve that first. But if you're someone that you've tried that, you want to go exercise and things are just really challenging for you, I want to break down some different tips to get going, some things that have helped me. So the first thing is, everyone's going to have their sweet spot approach, where that perfect approach for you, where you're not too sore afterwards, because that soreness can cause, unfortunately, too much fatigue, and it can be very, very challenging to get out of that soreness. It can maybe cause more tightness. That's a lot that I see is the workout maybe feels good, but you're too sore afterwards. So the first thing I would do is reduce the workout duration and really make it specific so you know exactly how your body responds. So for me, I would just choose kind of 5 minutes worth of a couple things, because I want to see, how do I feel during, but most importantly, how do I feel after? How do I feel the next day? Am I way too sore? That means maybe we've progressed too quickly. So I like to start with a couple minutes, and I like to progress slowly so you kind of know exactly how your body responds, right? We always want to know we don't want to be confused by what's causing pain from the workout. If you're doing a bunch of exercises, if you're trying a workout class, it can be hard to decipher what's causing the pain, what was too much. If you felt good during the workout, generally if a movement's no good, you'll feel it during, but maybe you feel good during, but not after. So that's where I like to reduce the duration. And maybe for a couple of weeks, you just stick to that 5 minutes, 10 minutes, a couple days a week. And then you can start progressing. Okay, these movements feel good for me. Maybe then I can add in more repetitions. But firstly, focus on how you feel. During, after is really the forgotten aspect of this, because maybe during you feel great, but after the fatigue hits you, the joint pain hits you. So that's the first thing I would focus on. Reduce the duration of the workout. The second thing is going to be change the modalities a little bit. For me, I used to really be into weightlifting kind of before ankylosing spondylitis. And when I went back to weightlifting, my body felt just so fatigued afterwards. The joint pain was worse. It was just too much on my body. So what I did was I added different things into that workout. So I would do weights. Maybe I would add resistance bands, body weight exercises. Maybe I would add some mobility during the workout so I could stay loose, stay limber. Loose and strong is always my goal. So the second tip is, whenever we're strength training, think about staying loose with the strength training. We don't just want to do a lot of presses so we're feeling a lot of it in the upper body. Maybe we want to bring the whole body into it. Think about staying loose during the workout. Maybe adding stretching, not just as a warm-up, but maybe a couple stretches during the workout. You're using different modalities. For me, I use everything. So I go to the gym, the machines, resistance bands, weights. Maybe I add some cardio with the strength training. So then I'm staying loose and I can feel pretty good and I'm reducing soreness. So some of the things to think about is adding some different modalities, putting it together in a way that maybe you haven't before. So that's the second tip. The third tip is going to be, I have to look at my notes for this. I've already forgotten the third tip. The third tip is going to be, I want to get back to the tightness. If you're really tight all over, one thing that really hurt me was stretching, forcing a stretch, and trying to stretch as hard as I could, especially stretches that felt tight. I said, oh, maybe I just have to try harder. That was the wrong approach for me. I had to find ways to stretch relaxed. I had to really reduce the range of motion, relax the body, breathe, slow it down. And even if the stretch felt like nothing, maybe someone was looking at me and they were thinking, he's not stretching, he's barely moving. But to me, I was getting movement, circulation, blood flow. I was focused on that area. One thing that can happen is if we force a stretch, maybe we start feeling in the low back. Maybe you're doing an opener because you're really tight in the upper body and you start feeling in the low back because maybe you're overextending. So I would really start with that reduced range of motion, breathing controlled, slowly. And that's how I started to stretch. I had to relax the body and I had to really think about, what am I stretching here? Do I have tight hamstrings? Maybe a traditional stretch was causing low back pain. So maybe I had to try a different modality. Sometimes I would get on the ground and work on different hamstring mobility, but relaxed, really slowly working that range of motion, reducing the range of motion. Even if it feels like nothing, I'm fine with that because we can start bringing some blood flow. You start thinking about that area that we're stretching, and over time you'll really see that it'll improve. So the third tip is, with stretching, don't force it, especially in the beginning. Reduce the range of motion, try to relax the body. And there's so many different ways to stretch, and what I found is my body responded better to certain stretches than to others. Maybe some movement felt good for me instead of trying to hold a stretch. So find different ways to stretch, reduce the range of motion. Maybe work less repetitions in the beginning. Maybe you don't want to hold a stretch for too long. Maybe you want to start with just 5-10 seconds. So really make it specific to you. My favorite stretch over the years have been modified stretches. Supported downward dog is one of my favorite stretches if you follow me on the channel, because the downward dog on the floor I do sometimes, but sometimes it's just too tight and it just causes me pain in certain areas. So the modified version, I can carefully do it. I can progress it slowly over time. So 3 is going to be the stretching, make it specific to you. So my fourth tip is traditional stuff. Maybe someone's telling you, all right, we're going to do traditional exercises, the bench press, the deadlift, the squat. This is how you get strong. This is how you get flexible to do these specific stretches. What we're seeing evidence-wise is we can build muscle in a million different ways. I think it's important to try to progress things differently, but maybe a movement's just not for you, right? So I used to love to deadlift. I still deadlift, but my body wasn't in a good position to deadlift when I was really dealing with tightness. So I had to do different things. Maybe machines can get you going. If you're really struggling, that's where I like machines, because we're in a fixed position. We can really focus on the posture, the core. We can focus on strengthening that area, maybe strengthening the hamstrings, without just forcing some of these movements that you might not be ready for. Maybe you're ready for the movements in the future, but maybe in the beginning, we use different techniques to strengthen the body. So the fourth thing here is, find the best techniques for you right now. What's your sweet spot where you can work on strength without causing any more joint pain? And that's where, for me, it was resistance bands and machines before the free weights, before the weights, and before these traditional movements. And then over time, I started to work some different traditional movements, but mostly I still use a lot of machines, a lot of resistance bands, because I could strength train in a little more joint-friendly way. So if something's not working for you, maybe get rid of it. Try something else. I think it's important to not keep pushing things if they just keep causing joint pain. There's a million different ways to strength train. Try to use some different techniques. And again, I talked about reducing the range of motion. So maybe you're having a hard time pressing overhead and you want to use a machine. Maybe you reduce the range of motion with your back flat for now, instead of going full range where maybe you're too tight. So even with strength training, I think it's okay to reduce the range of motion. And I'm talking non-traditional, because traditionally you'll hear, all right, maybe do 3 sets of 10 repetitions for an exercise. But for me, I was so weak in certain areas that I would just do a couple repetitions just to get going. So this 5-minute approach where maybe you're doing just a couple exercises and you're seeing how your body responds. You're activating these muscles. Sometimes folks will say you can't build muscle without going to fatigue. You have to go close to fatigue. Sure, the evidence does show that we want to go as close to fatigue as possible, but that doesn't mean you start there, and that doesn't mean you can't use those other methods over time. I think it's important to activate the body and really start slowly. So forget 10 repetitions if you're struggling. Start 3 to 5 repetitions, really focused. Maybe you're having a hard time doing a bridge, getting the glutes activated. Maybe just do a couple repetitions and you keep it moving from there, and you can start progressing it that way. So sometimes we have to go non-traditional, specific to you. For me specifically, certain areas got really weak because of my low back problems, and I really started with just a couple repetitions. How do I feel? How does my body feel? Progress slowly, and over time, I was able to build it. But non-traditional is the way to go. I'm gonna look at my notes here, see if we have anything else. And one thing I've touched on a little bit is the progression. I think the progression with arthritis needs to be a little slower. So maybe you find a couple of these exercises, that 5-minute approach that works for you, and maybe you stick to that for a little longer. Instead of pushing it, trying different things, build your base for a little longer and find a base you can always go back to it. For me, I found a good base years ago when I kind of completely changed my approach with the modified stretching, the resistance bands, and I stuck to that for a while because I felt good and I wanted to keep building before I try different things. So maybe start with a slower approach, progress slowly, always make sure your body's responding well. But over time, we can progress more and more. The more we feel comfortable our body feels, maybe we've dealt with the compensations more, we've built it up a little slowly, then we can start to have a little more confidence and start building more. But always think about progressing a little slowly. Let's see if we have anything else today. So that's the last of it for today. I'm going to make a video on kind of a beginner's routine for arthritis for this exact topic. If you're someone that's really struggling to get moving with arthritis, nothing seems to work, you even heard this today and maybe you're still don't really know where to go from here, I'm going to make a video specifically about how to get started, how to focus on the core in a spine-friendly way, how to do strength training in a little more joint-friendly way. That's been my focus over the years. I'll get into a video for that. But I want to hear from you all. Are you someone that struggled to get moving over the years? Exercise causes more pain, but you're desperate to find a solution. Let me know in the comments, and let me know from everyone what's helped you over the years. I shared some different tips today about things that have helped me. What's helped you kind of break that pattern and get moving safely in a way that works for you? That's really helped you progress strength and flexibility for arthritis. See you next time, everyone. I hope that helps. Let me know in the comments.